My name is Jess Brand, and I'm the Regional Director with Indwell here in Hamilton.
I'm Katherine Kalinowski. I'm the Chief Operating Officer of Good Shepherd in Hamilton. Sure. Good Shepherd is a large multi-service community health and human services organization, and our connection to the HART Hub is firmly grounded in the fact that we have a crisis of significant proportion in this community around addiction, substance use, toxic drug supply. So we are partnering with the HART Hub looking for solutions, and to support people. We'll be providing some emergency shelter accommodation for people as they're preparing to embark on a pathway towards recovery and healing. And we're also going to be involved in providing some supportive housing for people who are leaving treatment and reestablishing themselves in the community.
Indwell is one of the supportive housing providers that individuals who participate in the HART Hub can achieve supportive housing. And supports on site will provide them with connection to community, a chance to rebuild relationships, have addiction support ongoing, and working collaboratively with Hamilton Urban Core and our other partners in supporting people as they go through their journey. Indwell is a supportive housing provider, and so our role is after folks have come to the drop-in center, they've participated in some of the recovery programming, and they're looking to enter the next phase of their journey. And so we are the supportive housing provider. Our on-site interdisciplinary teams have medication support, meal support, whatever support the person needs in order to maintain their own stability. And we're there to calibrate in and back, depending on a person's needs.
Our supportive housing programs are really geared to helping people re-engage and become members of the community they live in. It's recognizing that they've likely experienced a fair amount of trauma and certainly a tremendous amount of stigma. So finding their place in a community is really important to recovery. And that community can mean the neighbors in the building they're living in, but the broader community as well. So our focus is on helping people with the really practical issues of establishing one's household in the community. That could be about getting a bank account, learning where the grocery store is, working on budgeting, if those are things that are needed. It could be about reunifying with family or friends in a really positive and healthy way. It could be about vocational support. We really recognize that people, especially people on a journey of recovery, are not necessarily following a straight line. So we'll be working closely with HART Hub staff to support people on the very best days as well as on the days they're struggling. Recognizing the level of service really depends on what the experience of the individual is in the moment.
Housing is the foundation, it's the first step. After we've met people and met emergency needs, we need to do that absolutely. And once we've met those emergency needs, beginning the next stages of the journey require a stable foundation. That stable foundation means that people can move from needing to protect themselves in order to actually care for themselves and to actually begin to experience hope and to take those next steps. When you know that your home is going to be there after you leave for the day, you can come back home and it will be there. Things will be where you left them. That makes all the difference. You can begin to make friends, you can begin to participate in some of the things that give life joy and meaning, like school or volunteering, just friendships, the stuff that we all enjoy. So by meeting people in their homes and by providing supportive housing, that gives us a really amazing opportunity to walk alongside people. Begin by building trust. And we'll be doing that alongside our other partners with the HART Hub. A key piece is working together with Hamilton Urban Core, but also with Good Shepherd and with Centre de Santé and Devoir de Disney, the other partners that we can actually build a community where people can start with trust and then move into taking next steps in their journey. Our interdisciplinary teams offer nursing support, psychosocial integration, addiction support, social work, all the different aspects of our lives that we'll be able to meet people and adjust based on need with the trauma-informed approaches of meeting people when they're ready, as they're ready, but actually being there. We can actually journey alongside people as they take their own steps.
Yeah, I think that I I think that having housing as a base for thriving as opposed to surviving is really an important concept to think about. And how we help is really about listening to what residents of a supportive housing program individually want and need and aspire to, rather than having some formula that will match or meet their needs. So it's being present, it's making resources available, from professional resources to recreational opportunities, vocational and educational opportunities. It's taking a holistic approach and working under the guidance of the individual who is the expert on what they need and what their recovery is going to look like. No, I think it's more about an emergency shelter is a place where you go when you have no safe place, no safe accommodation. And it provides basic needs primarily. Hamilton operates and Good Shepherd operates housing focused shelters. So we're aware that housing is the foundation to anyone thriving in their community. But an emergency shelter is a temporary stop along someone's journey towards permanent housing, be that supportive or affordable housing or market rent. But if you're absolutely homeless or the home you have is unsafe and very precarious, emergency shelter is a place where you have some supports and your basic needs met while you do the work for the next steps along your journey.
That gets philosophically at what underlies all of the supportive housing that we do, that Good Shepherd does. That is that stability it's part of a lifelong journey, and we all have factors that help us stay stable. We're all in some form of recovery, even though we don't talk about it necessarily that way. But we have things that help us stay well, help us engage in the community, maintain friendships, maintain our health. And supportive housing is there to ensure that those pieces are in place, particularly when perhaps they've broken down in someone's life previously for all different kinds of reasons. And so there are trauma pieces to that, there's mental health, there's addiction, there are different pieces that are part of that. And we recognize that it's quite complex. And so in supportive housing, we have staff and a community who are there to journey with someone through as long as they need to in order to maintain their stability. And for some folks, that means that they're actually checking in with a nurse or a staff person every day, and somebody else, we won't talk with them all that often because they maintain their stability quite well. But when they need someone, we are there. But changes happen in our lives. You have a family member who is a key support, and that person passes away, and suddenly you have to rejig your support network in order to stay well, or you get a new medical diagnosis. So our staff are there to journey with our tenants, with our residents, with folks who have lived in our supportive housing, so that they can maintain that stability year over year over year. It's not a one and done linear process. Our lives are complex. We know that. There's lots of different pieces to that. And so it is with supportive housing. We are there in many different ways to support folks. Feel free to jump in.
Well, I would just say that our experience, and we've been providing supportive housing in Hamilton, both Indwell and Good Shepherd, for many, many years. And there are people who will use supportive housing as a springboard to the rest of their lives and won't stay in supportive housing forever because they don't need that level of intervention or support, as dynamic as that is. And then I personally know from our experience at Good Shepherd that there are people who have struggled with intersecting challenges and barriers, including significant addiction issues, who have settled into supportive housing and managed to maintain optimal quality of life and health and well-being over decades, and are valued members of a community and get great enjoyment and satisfaction out of life. I think supportive housing as part of a recovery continuum can be really, really important because it gives people time to integrate what they've learned on their journey towards recovery and get on solid ground.